Hi, I'm Dr. Raquel Concepcion, one of the evaluating psychologists at Pediatric Psychology Associates.
And my name is Dr. Bridget Davidson. I'm also one of the evaluating psychologists at PPA.
So thank you for joining us, Dr. Davidson. I often have parents of preschoolers ask me if it's too early for an evaluation. Can you tell us your thoughts?
Sure. So actually, we often do evaluate preschoolers at PPA. These psychodevelopmental evaluations are often helpful when there are concerns in one or more areas of a preschooler's functioning.
So during these evaluations, what is the psychologist looking for during the developmental evaluation?
So we look at a child's thinking and reasoning skills, so their intellectual abilities. We also look at their learning, their kindergarten readiness. We examine language, social skills, a child's emotion regulation, their attention, and their behavior.
Yeah, so it sounds like a really overall process that you look at. With that, how does the process of the evaluation actually look like?
So we interview parents first, and we spend 8 to 10 hours across several sessions with the child. We are sure to review any previous records that are important. We also ask parents and teachers to complete questionnaires, and we consult with teachers or any other professionals working with the child.
And so, what is the ultimate outcome of these evaluations?
So after the testing is completed, we have a separate meeting with parents where we really go over the results, and this may include a diagnosis, but more importantly, we provide recommendations and create a plan of action.
That sounds great to be able to get that plan of action. Otherwise, what are some of the benefits of being able to evaluate a child when they're this young?
So these types of evaluations really help us to better understand the child's strengths and areas for growth. And this way we're able to come up with a plan to support them, whether it's through treatment or educational planning. Our evaluations are also used, if needed, for an individualized education plan, a 504 plan, or other supports through schools. And also to qualify for supports like Step Up or insurance coverage for services.
How long is typically the process?
So it does vary. Generally, the process can take around 4 to 6 weeks in most cases, but sometimes we do expedite these evaluations and schedule all of the sessions in just 1 week with feedback a couple of weeks later. It really does depend on the provider availability and the family's needs, but we try to schedule these as soon as possible. We also do serve international families, so we try to work around their travel schedules if needed.
Thank you so much, Dr. Davison, for sharing more about these psychodevelopmental evaluations.
My pleasure.